The reinforcements have landed. Thousands of medical professionals and infectious disease experts from around China have touched down in Hubei province. It's ground zero of the coronavirus, and where 56 million people are on lockdown.
We will treat the severely infected patients and guide hospitals in the prevention and control of the epidemic. We have to protect the medical staff as well. Otherwise, it's like soldiers going into battle without guns.
Beijing is extending the Lunar New Year holiday in a bid to slow the spread. It's increased funding in the fight to control and prevent the disease and approved new coronavirus detection technology. But all of China's efforts may not be enough to prevent a pandemic. Beijing has been criticized for shortfalls in protective gear and medical supplies, while it's estimated that 5 million people left Hubei before the lockdown. The virus is getting stronger, and health authorities predict the same prognosis in neighboring provinces.
The number of clinical or clinically apparent confirmed cases should be somewhere around the region of 25 to 26,000 as of Chinese New Year Day. And on the right-hand panel, inclusive of those who might have been incubating and therefore had not shown any symptoms yet, the number approaches 44,000.
China's Health Commission has sent its report to the World Health Organization before an emergency meeting between the two on Monday.
We have to be prepared that this particular epidemic may be about to become a global epidemic. This is not a certainty by any stretch of the imagination, but there is a not weak, or there is not insubstantial probability that this might happen. And therefore, we must prepare better for it.
Experts say this is a critical moment, and while there's no cause for panic, there's no time to waste. Sarah Balter, TRT World.
Well, for more on the coronavirus outbreak, let's speak to Christian Lindmeier. He's a spokesman at the World Health Organization in Geneva. Welcome to the program, Christian. Now, when health officials from the WHO met last week, they decided against declaring a global health emergency over this outbreak that started in China, with the number of people dead now rising, including the number of infections climbing to their thousands. Do you expect the World Health Organization might change their minds and actually declare a global emergency?
Thanks for having me. So look, there are nearly two separate incidents. The one is the crisis and the emergency we definitely see in China. And the pictures are very drastic, as you know. Empty streets, people lining outside of hospitals, other hospitals being built from the scratch in a record time. So this is definitely an emergency. But so far we have seen transmission of cases mainly, if not only, in China, and all go back to Wuhan and are related to either family connections or to medical staff. Travelers have been bringing the virus outside of China. That is true. But the important point here for declaring it an international public health emergency of international concern would be that these transmissions outside of China possibly continue, meaning that a traveler transmits to another person, to maybe the bus driver, the taxi driver, the clerk, the baker, who knows what, or inside his own family. And we have only seen so far one onward transmission. So of course, because of this, experts and scientists all around the world are monitoring the situation very carefully, and the members of this emergency committee do too. And should the situation change in any way or a more drastic scenario, they will reconvene in no time, and they can do because they're being called together on telephone, they can do in literally no time, and will reevaluate the situation.
Now, as we know, Chinese officials have taken dramatic steps to try and contain the virus, including the locking down of literally millions of people in and around the epicenter of that initial outbreak. Why then are we still seeing a rise in the number of deaths and an exponential increase in the number of people infected?
People are still having a life. So people are still meeting somewhere. People are still going about their everyday life. They need to shop. They need to. They are sitting together in families. Just because the major hubs are down and maybe the streets look pretty empty, you still see pictures also of people traveling, and you see the pictures of the screenings going on, and these screenings are important. But of course, where there's people will be moving in some sort of way. So of course we see transmission ongoing in some way, but again, mainly in close groups like families or in medical facilities, and that these are two very important and very distinct places, and this is where we need to get a grip on.
What progress is being made in terms of finding a possible vaccine for this type of coronavirus? How far away are we from seeing something like that?
Look, the development of a vaccine is not something which is done in a day or in a night. Alone the production line can take anything between 6 and 9 months, depending on how specific it is. And then we still need the science before that to determine exactly what type of vaccine we can produce or the industry can produce in order to make it available for the people. So this is not something for the short term. So we should focus on what we know so far and what we can do so far. So the treatment of people, and that's a very unspecific thing because we don't have specific treatments, only according to the symptoms that people show. So we can only treat so far the lung infection, the cough, the sneeze, the fever. Much more important would be that people take a good care of themselves in their everyday life, to run regular hand hygiene or regular body hygiene when they meet people. So if you meet somebody with a flu and that virus is very much comparable, you would also stay not too close. You would not maybe hug somebody who's sneezing and who's having a high fever. So that should go the same way. And if you have to be in a group with people where somebody's infected, well, protect yourself maybe with a mask and wash your hands afterwards thoroughly or use the hand sanitizer. And if you yourself are infected, well then don't sneeze or cough into the open. Use your elbow, use a tissue, and then discard the tissue afterwards, and possibly stay away from larger crowds. So these are many things the individual can do. And the state or the health authorities can prepare the health system for receiving patients, identifying patients, monitoring them, treating them.
Now, we've had two similar outbreaks of coronavirus in recent years, the SARS outbreak of 2003 and the MERS outbreak that began in 2012. How does this type of coronavirus compare with those two previous ones?
It's slightly difficult to say because we don't know everything about this virus yet. So we know because it belongs to the class of coronaviruses how it behaves slightly. But we also know that the incubation period is not yet very clear. It's anything between 1 and 14 days, we hear what the scientists say. You can have very mild symptoms or very strong symptoms. We don't yet know, for example, if somebody who has very mild or maybe is symptoms or maybe is asymptomatic, so is infected but doesn't show symptoms, if they still can transmit the virus. So we have a couple of unknowns there, which we still need to fill the gaps on. And so science and the experts are really asked to look into this and to study this virus very carefully to know what we're dealing with in order to know what we need to respond to.
Okay, Christian Lindmeier from the World Health Organization. We'll have to leave it there, but thank you so much for that update here on Money Talks.